WCNC Charlotte, this is Flashpoint.
Thanks for joining us here on Flashpoint. I'm Ben Thompson. Today is the start of National Mental Illness Awareness Week. It's a big issue not only here in Charlotte, but across North Carolina. Data from the National Alliance on Mental Illness says more than 1.4 million adults living in the Tar Heel State have a mental health condition. For a quarter of those folks, their illness is considered to be serious. A little bit later, we'll hear from state health officials about how they plan to address suicide here in North Carolina. But first, we're speaking with CMPD about some of their work to help de-escalate situations involving community members with behavioral health issues. Joining us now, CMPD Lt Joan Gallant, who heads CMPD's Community Wellness Division. Lieutenant, welcome to Flashpoint. We appreciate you taking the time.
Absolutely. I'm happy to be here.
All right. Explain to me, your team has been around for a few years. You've been a part of it for the past year. So why is it an important mission that a lot of people might not be the first to think about when it comes to being involved in the community and making sure things are okay before they reach, say, a criminal level that people often associate with police?
Sure. So CMPD has a unit called CPCRT, which is Community Policing Crisis Response Team. And we've been around since 2019. And the unit was formed when we recognized a need in the community through calls for service. Essentially, we identified that we had close to 1,000 calls for service prior to 2019, where folks were experiencing a variety of mental health crises. And that can include things like substance abuse or any other number of situational crises, just based on different needs of the community. And we wanted to respond to that need, making sure that we were connecting people to the right places so that they didn't have to be involved in the criminal justice system and they didn't have to go seek assistance through an emergency room or some of the other more common areas that folks were really finding that they had to go in order to get some of these services that they needed.
Okay, explain to us what a call for you is different like than, say, a call that people think about in a more traditional fashion, as far as a call comes into 911, somebody's been hurt or shot or something like that, and we have police officers go to the scene. You're responding to something differently. Explain that to us.
Sure. So we respond to any host of calls for service related to persons experiencing a crisis. And that crisis can be anything. It can be mental health, substance abuse, homelessness, situational. And when I say situational, somebody could they could have just lost their job. They could be experiencing grief and those things where they don't know who else to turn to. And so it's easy to call 911 because everybody knows the number and they know that we're going to respond and we're going to get folks the help that they need. So we respond secondarily to patrol. Patrol will go because there is always a safety aspect that needs to be, we have to be mindful of because we have mental health clinicians in the car with us. So we will respond secondarily to patrol, who's evaluated a scene, ensured that it's safe, and then have identified that the person that they're interacting with really could benefit from some more wraparound services and some closer attention. And so that's how we will respond. And then it allows the patrol officer to go back to answer calls for service that are more related to what their goals and their mission is every day. For example, answering the car break-in calls or the house break-in calls or the other types of criminal events. And then we will take over and get folks connected to the different types of services that they may need.
You mentioned wraparound services, and I think that sort of brings me to this next question, that in the last few years in our country, we've talked about the role of police and whether or not we want to defund them or anything like that. But I feel like what you're describing is sort of a response to that, as in a more nuanced approach to where police might not always be a solution to the problem we're seeking, but in a lot of ways, police can be helpful. And if it's not a patrolman, it can be something like this, where they're going in, talking mental health, have experts there at the ready, and addressing some of these issues in a non-confrontational way.
Exactly. It really allows us the opportunity to provide humane and compassionate and professional services to folks, ensuring that we're giving the best police services that we can. And police services include any host of things, not just answering a call that is regarding a crime. You know, we are the helpers, and folks call us because they need something and they don't know where else to turn. And we recognize that it's easy for folks to say, well, you know, that's not a police activity, or so on and so forth. But our community needs us to be able to get them sometimes just pointed in the right direction. And that's really what this is intended to do, is to provide all of those different needs to our community members, meeting them where they are with what they have and not expecting them to bend to us. It's important that we acknowledge what our community needs and that we give them what they need and what they expect. And people, we know that they expect us to help them in whatever way that might look.
And maybe this would be a better question for the chief, but I have you here, so I'll ask you. How do you think this has been received within the department and within the community? Is this perceived to be a wide success? Absolutely.
Number one, I think first and foremost, having a unit like this helps everybody, both the police department and the community, start to understand and dispel the stigma related to mental health. This is a difficult topic for many people to discuss, to face, to address. And when we're willing to approach topics that are difficult for everybody else, then I think that helps all of us internally and the community really develop a comfort level with addressing the topic in and of itself. We have success-wise, we have answered, since the unit was created in 2019, more than 7,000 calls for service. Year to date, we're well over 1,000 calls for service, where folks are calling for things. We are identifying the needs and being able to respond appropriately. So it's absolutely a success, and the benefits that have come from it, help teach the police officers better skills, help officers understand the different needs of the community that they're serving, helps the community understand that we want to be here to get folks assistance, help, and resources that they need, and that we recognize that folks are going to call us because we're the ones that, at the end of the day, when something is just so difficult for them that they need somebody to help them, they know that they can always count on us to be there for them.
I assume, like pretty much every field in this country, you've been affected by the labor shortage. Is that in case the fact for you?
As far as the police department is concerned, yes, your recruiting is a challenge for us right now, as it is across the country. And anytime that we have, vacancies and staffing shortages, then that impacts service delivery. Whereas maybe we may not be able to add more officers to our unit. Maybe we can't expand the hours that we're available because of some of these staffing challenges. We have a lot of responsibilities, and we're trying to be mindful of all of them. And yes, of course, staffing shortages do create challenges for us, but they aren't something that we aren't willing to try to overcome. It's important that we're creative so that we can make sure that we're delivering the services that the community expects us to deliver.
So then the logical final question here is, given the success you all have had, given the fact that you seem to be quite effective in responding in a more nuanced way to community members in need, but given the fact that you are also part of a police department that is seeing this shortage in staffing, like so many other workplaces across the country, how do you expand what seems to be a otherwise thriving department within CMPD?
So I will tell you, we did expand at the end of last year. We doubled the unit. So we went from 6 teams to 12 teams at the end of 2021. So that should tell you right there that even though we have challenges, we are still expanding where we've identified a need. We will continue to evaluate and expand appropriately as best we can with the what we have available at the time.
All right, Lieutenant, thanks so much for coming on and taking time, and thank you for what you do for our community every single day.
Thank you very much.
All right, more Flashpoint after this.